All right. So almost everybody is now on the ground floor. Those that have difficulties in leaving their computer, we're able to to bring them down and work further on the computer. All right. So I'm also very happy that the Federal Minister of Public Health joined us today and started informal contacts with some of the teams, and I think that she still has some time to follow the presentations of the teams and the pitches. Minister, thank you for visiting us. So it's a very short session between now and the presentations. So what we are asking is actually that each team presents itself. So who's the team, what team members are present today, and perhaps also tomorrow. What is the background, and why did you join actually the hackathon, and what is actually, do you already have some kind of an objective? What do you want to establish by tomorrow evening during the hackathon? All right?
It's important that...
Okay, so I've been informed that it's important to get on the platform, so it's also important for those doing the presentations. So are there volunteers to start with the first presentation of the team? Otherwise I will, okay, Jan is volunteer.
Simply, my name is Jan Vertriest. I'm working with MSD, an innovative pharmaceutical company. And we are here with a team of 4 people. Someone from IT, not surprisingly. Someone from access management. From IT, Stefan de Wisch. Sorry. From access management, an HTA manager, Steve Vermeers. And from the oncology department, a physician, Joris de Ranter. Not only physician, also a civil engineer. So a lot of technical capabilities. And I'm working in the policy department, so I'm here for the talking. Our objective, well, as a company, we are active in therapeutic areas such as immuno-oncology, acute hospital care with hepatitis C. We also have biologicals. So these are important therapeutic areas today. And the objectives for us will be to have a look at those therapeutic areas. Like, you know, for hepatitis C, there has been a change in reimbursement criteria. So we would like to look for a model to look in the future for the uptake, the usage, the number of patients treated in Belgium. So these are one of the objectives. We will start on a volume base, but then try to dig deeper and find specific findings. Yeah? But that will be the job of tomorrow, of course. We will see where we land, and that will be presented tomorrow afternoon, I think. Yeah.
All right, thank you.
Thank you.
Next team, volunteers, or do we just follow the, all right.
Good evening. We have a team of 5 people. My name is Luc Belmans. I'm working in healthcare every day. I'm in the management of a little hospital near the biggest hospital in Belgium, in Leuven. We care for people every day. So I'm very interested in medicaments, the price of medicaments. In healthcare, we are every day we see that there are resources and the amount of care that we have to deliver is going going upwards. So who is our an entrepreneur who is working on an app to make healthcare better for the people. We have a student in biomedical science, and then the two data scientists are over there on their computer, I think. They are working in a software company, and another is really data scientists who followed some data science courses here in Digitizer. We have just downloaded the data, so at this moment we are making our hypothesis. We are searching for something that will give an answer to less money, more care, and better care. That will be the solution we hope to find.
Those are very interesting objectives. Thank you very much for the start. All right. Other candidates? Okay, so they're coming up.
We are Y hats. Y hats. Just a Y and a little head on it. No. Like in when you specify a statistics model. I don't know how it's named. Does someone know the official name for the accent circonflexe? No. That's not the one. That's not the one. Yeah, exactly like that. So we just had our first look at the data. We're not sure what we are going to do yet, but it will involve something with predicting. If somebody can add something on it, maybe Quentin.
So we say we all come from different backgrounds, and we are most IT here. But in our team, we are almost half-half entrepreneurs from business school, let's say, and half from more IT. So the goal of what we do is actually to get to know each other better, to understand that this very moment is important, because maybe we're gonna help to do something, and maybe all together we can find ideas that we can actually launch after. So our goal, especially with Libé, because she's hosting me for the moment because I don't have any more money, so feel free to help. Our goal is actually to really do something after. So if at the end of this evening, of this event, you really want to test your ideas, come to us, and we will see if we can do it together. Thank you.
Oh, thank you. U Hasselt. All right.
Hello, so my name is Lisbeth Peters. I'm a data scientist and an idealist. I have a very strong personal mission to transform the care of people with multiple sclerosis, which is an autoimmune disease of the nervous system. So, like this? Okay. And we are actually working on that full time at Hasselt University. And teaming up with KU Leuven, so we also have a representative of KU Leuven here. And in general, we are focusing on MS data handling and analysis, because we believe that the care of people with MS is not good enough. That's just a summary. For example, a friend of mine, Helen, actually spent 5 years trying to find a proper diagnosis, prognosis, and a treatment that was fit for purpose for him. And in my mind, that's just too slow. So we really need better decision support systems that can find a good drug that is fit for purpose for that specific patient. And that is really my mission. And I believe that data can actually serve that purpose. So we have a very multidisciplinary team. My background is already quite interdisciplinary. I'm a bioengineer. And I'm actually most of the time just a spokesperson and trying to formulate the hypothesis. And then those two are actually doing the analysis, so I will give them the floor as well.
Okay, hi. So yeah, I'm a PhD student at KU Leuven. I mostly work on machine learning application for patient trajectory, so really in healthcare, but like trying to analyze the temporal development of diseases.
Okay, yeah, my name is Jan Dieperman. I'm also a PhD student, and I'm doing also research on doing predictions about the progression of MS using these evoked potential time series. For this, we use machine learning mainly, and large data sets like we hope to use today.
All right, thank you very much.
Oh, good evening all. We're Novartis. Novartis is also a pharmaceutical company at the forefront of innovation, like my colleague. And we're really very interested in everything what has to do with diseases where high medical need is. So we're very active in most of these disease domains, including oncology, neuroscience, and degenerative diseases. So we're with a rather big team here. Myself, I'm medical and engineering from background. I've got my colleague medical here as well. Then we've got someone from business, and we've got our techies sitting there somewhere. And we're going to attack the database really with a quite strong ambition. So what we think is that if you look at medication, hospital medication, then of course you're looking at the diseases as well. So we're going to try to understand the diseases out of these medications. That's one thing. So that's more into epidemiology if you want. We'll try to see then for some of the diseases, for example, losing sight at elderly age, whether the treatment intensity of these patients is good or could be better. And that's a challenge already. And we were already checking with the technical people here whether we couldn't look at kind of concomitant medication. Unfortunately, that seems not to be the case, but okay, we'll still go a bit deeper into that, because then you have, of course, comorbidities of these challenging diseases. So these are our ambitions, and we'll see where this is going to lead us. And by the way, you Hasselt, we're also very interested in MS, and we'll be a bit competing there with you, okay? Thank you.
Thank you very much.
Thank you.
My name is Marijke, my colleague Tom. So we're a team from Health Data, so the Health Data project under Johan. So we're more technical people. I myself have a background in mathematics and statistics. My colleague Juan has a technical background. And we're here to play around with data, help people if needed, to create some dashboards or some forecasting.
So my name is Tom. I brought my colleague Bruno. We also work for Health Data. And our goal is to, well, mainly first look at the data. What do we have? Which data sets well, can we see? And how can we merge data sets? Or how can we combine these data sets and get some useful answers there? So mainly from the data perspective. We don't really, well, more exploratory in that sense.
Hello everyone, we're from AstraZeneca. I'm Marieke de Boek and I work on the market access department, and this is Stijn de Dekker, he's an IT'er. So we're here to, of course, we develop innovative medicine. We want to put them on the market, but not only put them on the market, we also want to get them reimbursed for the patients, to give them access to our medicine, and therefore we need very strong reimbursement files and also, of course, strong data to support our reimbursement files. And this is why we are here today, to have a look at what the DocPH database can offer us to strengthen our files. We were thinking, we are actually zooming in on oncology products, and we were thinking about maybe getting more data on the number of treated patients, the duration of the treatment, and so on. But we will see where it will lead us today.
Thank you. Did we have all teams presented? So,
Hello, I'm David. We are a team from Edina, which is an ICT consultancy company. I'm here with my colleagues Jasper, Sonia, Jolien, and Dieter, who will be joining us tomorrow. We're all data scientists, and we will be working on the following topic, demographic patterns in health consumption. So we will try to see whether the uptake of particular medication, how it evolved over time, and how it will evolve in the future. And we also try to make some predictions about budgetary implications, about how about reimbursement patterns and how they will be involved in the future. And we will take into account population trends. So we'll be starting with the case for Brussels. Brussels is known for having a population explosion over the recent years. And most likely this will have a particular effect on the uptake of certain medicines, and this will also have a high impact on the costs of regarding the uptake of the medications. Thank you.
thank you very much. So if there are no teams anymore, then oh, sorry, just one.
Hello, we are a team from IQVIA, the human data science company. So we have a cross-departmental team here joining today. So we have Pierre, who is a health economist, who is working supporting a pharmaceutical company to get access to the market. I am a consultant in data analytics. We have also Marta and Olivier working for services for hospitals, and we have Jens as a data scientist. So we have different objectives for today. We want first to create an easy exploration tool for the data, because for the data to be accessible to everybody, and that's also the goal of this initiative, it needs to also be not just for the ones that have programming skills. So we want to create this tool that will make everybody be able to analyze the data. And we want also to make other analysis specific to public health and to the evolution of reimbursement of different drugs. And so here we have a few ideas of which drugs we want to analyze. I don't know if you want to say any more.
Well, I don't have so much more to say about that at the moment, because we are, of course, in the first phase of discovering the data. So we have some ideas, but we will not first need to see whether we can implement them. But I would say, from my perspective, being indeed from a health economist and more from a market access background, data is something very important for us, because this is what helps us supporting our clients in the pharmaceutical industry in their discussion with the payer, help them bringing new therapies on the market, or also help them when discussing reevaluation on therapies that are already in the market. So at IQVIA we have data, it's not a secret, but we are always interested in any opportunity to develop partnership and to have a chance to improve our knowledge of what happens in real life, because that's really the core of what we do as part of our market access activities.
Okay, thank you very much.
Good evening, everyone. I'm Timothy from Bayer, where I work as a health economist.
and I'm participating today in this hackathon as a one-man team actually. I do have some remote support from the Netherlands, where we do have some data scientists who can help me if needed. But what I would like to investigate during this hackathon is actually a case study to see in a certain therapeutic area, namely the age-related macular degeneration, which therapeutic alternatives are available, and what the volume usage was in the past few years, and what the impact was of the different changes in reimbursement conditions on that usage. So, yeah.
Thank you very much. All right, I think that I'm not certain that all teams have been presented. So thank you very much to exchange already some background of your team and the challenges that you will take up. So in the next, I think there will still be a food presented in a while. I don't see it already on the table, but it will certainly come. And then when the food arrives, we'll certainly notify everybody. All right. So I wish you a lot of success in very exploring the data. If you still encounter problems with internet or the data set itself, please do not wait, because this is time that is expensive in this short period. So please mention these problems so that we can help you. Already?
Has everybody got a team? Everybody's on a team yet? There's nobody feels left out? Okay, excellent.
All right. Thank you very much for joining us on the floor.
Allez, hop, ça va, hein. Voilà. J'ai envoyé de nouveau un fichier Excel.